Hello and welcome to my presentation. My name is Marvyn Luna. I'm an occupational therapy doctoral student at Rush University, and the title is Virtual Reality and Upper Extremity Rehabilitation, Motor Impacts, a Pilot Study. So here are the table of contents. We're going to get right to it. So, virtual reality is an immersive technology that places a person in a 3D environment that has input with a multi-sensory system and gives augmented real-time feedback on performance. Tasks and activities can be simulated into this technology, making the person perform repetitive and meaningful movement patterns, which virtual reality incorporates several theories of neuroscience and motor learning. There is a wide range of evidence-based practice with using VR with the stroke population. VR meets the fundamental principles for rehab in stroke patients that include intensity, task-oriented training, biofeedback, environments rich in stimuli, and motivation, which can help the recovery process and even target some of the pain factors that some stroke patients have when they are immersed in a multisensory 3D world. A VR study on the effects of using such technology found some main neurophysiological findings, such as improved inner hemispheric balance, enhanced cortical connectivity, increased cortical mapping of the affected limb muscles, and improved neuroplasticity measures were correlated to enhanced behavior outcomes. Increased activation of the regions of the frontal cortex and the mirror neuron system may be involved. VR has also been shown to improve depression and physical features. VR may also enhance the neuroplasticity and reduce the use of non-use, which is a common aspect in chronic stroke patients and recovery after stroke when using VR. Provides augmented real-life feedback, immersive and engaging experiences, and a safe simulation of real-world activities of daily living, and is a promising tool that can lead to a better motor recovery. I chose Synapse House because they provide unique care that involves a work order day, which enforces task-oriented approach, which is suggested for neurorehabilitation to facilitate occupational performance on a setting that has a variety of acquired brain injury population. This setting allows for functional skills to be developed while also working on cognitive skills that can aid in my project. In addition, this setting used to perform cooking activities, and implementing this research only reinforces their occupational performance in this aspect. Consists of two groups. Group A will participate in a seated cooking VR experience for 3 weeks, 2 times a week, 20 minutes a day. Group B will participate in activities of daily living cooking real life simulation experience for 3 weeks, 2 times a week, 20 minutes a day. At the end of the third week, both groups will switch intervention and be reassessed. The groups will now continue with the exchange intervention for another 3 weeks and be reassessed again at the end of the 3 weeks again. The type of study I am implementing is a multiple baseline study. Some assessments were used to track their progress over the weeks, with the Montreal Cognitive Assessment being used at the start only. Members were asked to volunteer and would meet the criteria if they had no seizure precautions or any visual impairment such as hemispatial neglect due to the nature of virtual reality. The Montreal Cognitive Assessment is a tool that measures for early detection of mild cognitive impairment. The Fugl-Meyer Assessment of Motor Recovery after a stroke evaluates and measures the recovery in post-stroke hemiplegic patients, and in this research we are only using the upper extremity portion. The box and block is another assessment that measures a unilateral gross manual dexterity. So for my results, the performance of self-care skills is also known as the PASS, and we focus on the online bill pay, showed improvements. This is a performance-based assessment that shows a holistic snapshot of their ability to live independently and safely engaging in daily tasks. This assessment has many subsections, but I'm only focused on the online bill paying. Overall, there were no significant scores to their motor aspects. However, there was improvement in the cognitive portion, which involves the PASS. This can be due to the cooking simulation requiring careful reading and attention and following instructions, which overall seems to improve on their executive functioning skills. Some of my observations were seen during this experience was increased motivation, Members with low muscle tone that usually lean to the left or right due to their affected side were observed to have improved upright posture during the virtual reality experience, facilitation of using the affected arm, and working on their executive functioning skills. So overall, for future implications, I think that VR is in its infancy stage of technology. It would be unfortunate to not involve this immersive technology in the world of occupational therapy to help those in need. VR encompasses the multi-sensory system of the brain and can deliver countless benefits to people with motor and cognitive impacts of stroke. This study is a stepping stone to understand its effectiveness and to improve motor capacities and explore the region of the brain VR activates to better implement an intervention protocol for future rehab clinicians to use that is holistic and client-centered in neurorehabilitation in all settings with a more controlled and intense protocol. Thank you. And here are my references.